Hey everyone, this is Chelsea and Dr. Holland.
Hello everyone.
Coming at you today from Holland Health Functional Medicine office in Lowell, Arkansas, where we both get to work.
Absolutely.
So it's a beautiful day here. Thankful to be able to record this video for you today. Excited to share some information with all of you. And so first of all, I just want to thank Dr. Holland for taking the time to sit down with me and share some stuff with you guys. And I would love for him to just tell us a little bit about himself.
Okay, well, I'll do as brief as I can. I am a physician who is an osteopathic physician, been practicing for approximately 20 years, and I've lived in Northwest Arkansas for about 16 of those. And I've practiced mostly emergency medicine during my career and have always had a passion for functional medicine. That's why I went to medical school. I also do osteopathic manipulation, which was a big passion of mine before going to medical school and during medical school. So that's something that I continue to do and love to do. I'm very interested in holistic health, whole health, helping people get well, stay well, and live longer and healthier lives. So that's what Holland Health is all about. So that's a big reason that we're having this conversation today, to talk about the topic we're going to talk about, because I don't know that people can get well if they don't have some wellness in the area that we're going to talk about. So I'll let Chelsea obviously do her thing. This is her deal, so I'll let her introduce what we're going to be talking about today.
Awesome. Well, thank you so much for sharing, and it's a pleasure to be working with you. And
Absolutely.
I love that our whole team is just really on mission and cares a lot about helping people and just wanting people to be able to live abundant lives. And so, the reason that we chose the topic that we chose today is because April is actually Stress Awareness Month. You may or may not be aware of that, but we see stress all the time as a major factor in people's health. And really it is just something that everyone deals with, of course, to some degree. But we just know that stress affects so much in our health and is really an underlying factor. And so, Dr. Holland, if you wouldn't mind maybe sharing some of the effects of stress that we know to be true.
So, stress, everyone has stress. I guess the difference between just stress and distress is that people react to stress in all different ways. And sometimes stress is a great thing because it motivates us to do certain things, and sometimes it keeps us from being able to be healthy, though. And that's where we start to really see people needing to address some of the things that we're going to be talking about with the limbic system today. But stress is definitely a thing that will make our vascular system clamp down. It can cause things like heart disease. It can contribute to brain pathologies, including dementia. It can also include a lot of things with depression, anxiety. Will even increase your risk of certain types of cancers and things because of the chemicals that are released in our bodies, and the ways that we fight that stress are not usually very beneficial for us. So distress is typically something that we want to avoid. But if we have that distress, it's not that we can't improve our lives and get well from that, but we definitely have tools in our tool belt. And other people that we associate ourselves with here at Holland Health have tools in their tool belt to help you get over some of those things that are stressful. And so the effects are broad. I can't really nail down one thing that it does, but it's not great. I can just say it that way. If that sums it up, it's not real specific, but
yeah, for sure. Yeah, I think that's exactly it. That just there's so many effects, and so really, one thing I've been thinking about and reading a lot about is that we can't control what happens to us, but we can control how we respond to it. And so that's something with stress, is that just really learning to have a healthy stress response can be really beneficial in your journey of healing, and for all of us, because we're all going to encounter stressful things in our lives. And so that is why that we chose the topic of limbic system rewiring. And Dr. Holland is going to share more about what the limbic system is. And then we'll talk a little bit more about what rewiring looks like, and how, you know, we can give you some suggestions on how that you might be able to apply this to your lives, and how we might be able to help you.
Right. So the limbic system is basically it sits at the top of the midbrain. It's in the mid, so it's just above your spinal cord and some of those structures, and below the part of our brain that we use to think with and move and use for vision and that type of thing. So it sits under that and above some of the other structures. It's kind of a part of our brain that some people refer to as the ancient part of our brain. I don't really think it matters what people call it and when it developed, but it's all part of our brain, and it's part of who we were created with, what we were created with, and it allows for so many different things, and it's basically some people argue what parts of the brain are actually included in that. So there's the hypothalamus, the thalamus, the amygdala, and the I always get this because I think of this as I see a hippopotamus in my brain, because it's this structure that kind of looks like a horse, and the hippo is a horse, and so the hippocampus is that part of the brain, and so sometimes I almost say hippopotamus. So I almost said that just a second ago for hippocampus, so I apologize for stumbling through that just a little bit. But those structures are all part of, and then there are other things those are the ones that everybody kind of agrees on as far as part of the limbic system. There are other parts that some people don't necessarily agree with, but those structures are key in so many different ways. The amygdala is part of the fight, flight, freeze part of our brain. If people have damage to the amygdala, then they lose their ability to make decisions on fear-based activities. So they'll walk on the edge of a cliff without even worrying about it, or they'll be involved in types of activities that you know that are very dangerous, and they have no fear about. There are ways to invoke fear in those who have damage to their amygdala, mostly with CO2, but otherwise they don't really have any fear. So that's a part of that part of the brain. And if you think about it, what happens if it's removed, you can think about what happens if it's present or hyperactive. So people who have a lot of fear, who have a lot of anxiety, who have a lot of trouble with those things, their amygdala is probably the part of their brain that has some impact on that, and that has like the super highway to what we call the prefrontal cortex, which is the part of the brain that humans have that other animals don't have, which kind of helps us with executive function and decision making, and it also has a lot to do with emotion and depression and those type of things. So the amygdala has a big part of that as well. The hippocampus is the memory center. It's what helps us to develop memory, and so it's especially short-term memory is what's affected. So you can't make new memories if you have damage to the hippocampus, and that, again, if you know what happens if you take that part of the brain out, you can also think about what happens if you have one that's active. So if people have a hard time with remembering things, then that may have something to do with the hippocampus. And people who don't have a hippocampus, they'll wake up every morning and they'll have long-term memory, so they can remember things that happened before. But if you ask them a memory, or if you ask them if something happened, the last memory they have is what they had the day before, not what just happened to them 5 minutes ago. And then the other parts are the thalamus and the hypothalamus, and those are incredibly important structures. If you've heard of the things like the HPA axis, hypothalamus, pituitary, adrenal axis, that also that axis also involves the thyroid and the gonadal axis. So lots of hormones are produced by all those things. A lot of things are related to stress in those ways. So there are a lot of parts to this structure we call the limbic system. So if we can have associated memories because of the hippocampus and the amygdala that we then move into our prefrontal cortex. And if that moves there, then we have these memories. We associate memories like I think of it like hanging something on a hook. So if you have a coat hook or something you hang your towel on, we tend to hang things in our brain on those type of hooks when we associate those a lot of time with memories of our trauma. So when we have traumatic events in our lives, or we have good things, and that trauma can be good things, it can be bad things. So, if you have a birth of a child, that's a very happy thing, but then you tend to remember those things, even though women don't remember the extreme trauma of having a baby, or they probably would only have one. But
yeah.
But those who have multiple babies, the holding that baby, smelling that baby's head, all the things that go well with that, encourage people to continue to have children, even though there's something. But there are associated memories that we have with different traumas, and that's one of the things where people who have any type of severe depression, or they have executive function abnormalities, like they can't make decisions, they get paralysis by analysis is what I call that, then a lot of times that's because of the limbic system being a part of that memory making and part of that executive function. And we encourage people who get into those things where they're not able to make decisions, where they're severely depressed, where they're really anxious because they can't move past some of those things from those memories created by those structures in the limbic system. And so we oftentimes refer to that as retraining the limbic system. Mm-hmm. So we'll get into that here in just a second, but does that kind of cover the things that you wanted to talk about?
Oh yeah, that is such just a thorough review of the whole system. I'm really glad you remember the names of all those things.
Even though the hippo almost
very
became
thankful
a hippopotamus.
For that. Yeah. Yes, that was really good. So from my understanding, and I'll definitely, have you elaborate on this a little bit, but when it comes to the limbic system and needing to rewire the limbic system, we've spoken about stress, and you mentioned the fight or flight and freeze situation. And so what I understand is that through stress and trauma, and from various different things, whether it be childhood or traumatic events in our lives or health problems or death of family members, it can be so many different things that we kind of get stuck in. The brain can get a little bit stuck in this fight, flight, or freeze, which is a little bit of a tongue twister to try and say.
Yeah.
But it can get stuck in that stress response, and those negative pathways in the brain can really become kind of the deep paths that we just take, because that's kind of, what our brain's been focused on is the negative or the trauma or the stress, and it's just easier to go that way. That's kind of the path of less resistance. And so with rewiring, the goal is to kind of retrain the brain to be more into the rest and digest, and to be more into a healthier pattern, and to retrain it to take some different pathways. And there's various different ways we can do that, which we'll talk about. But from your perspective, why do you think that it is important for people to rewire the brain, or how could that be beneficial?
Yeah, so, if you think of extreme examples of where people are kidnapped and constantly traumatized, or you hear of people being sent into these, think about the constant trauma. You get into this repetitive trauma, even as a child, maybe with abuse, or spousal abuse or other things, you kind of almost get into this routine of believing that you deserve that, and you store those memories, and you don't think you can get out of it, and that constantly feeding that, it creates obviously a lot of bad things that end up happening in our brains, and then that rut is really difficult to get out of, as you mentioned. And one of the things that I see in what I'm doing as a functional medicine provider is, if I don't address the underlying conditions that are going on with people with their limbic system and their decision making and their prefrontal cortex, then they're going to have a very difficult time getting well overall. We see that a lot with pain syndromes. We see that a lot with gut problems. And I know that a lot of your audience and our audience have heard of the gut-brain axis, and how our gut is a big part of what is tied to our brain, and that's through the parasympathetic nervous system, through the vagus nerve, and even things like trauma to the head can change that. They've done studies in different types of animals where they induce a concussion, and within a few minutes their microbiome in their gut has already changed. Wow. And that's through that superhighway that we have between the brain and the gut. So people who have gut problems, people who have pain syndromes like fibromyalgia or chronic pain, oftentimes have those things because of that problem with that limbic system and that part of the brain. Do you mind if I use? I want to use a quick example. I was going through this example. Do I have time to do that?
Absolutely, yeah.
So just recently, I was working in an emergency shift, and I still work in the emergency department, and I had a patient who came in to see me for one thing. He ended up having some really, really bad stuff that we ended up finding on him. But one of the things that he had said is, I said, "Do you have pain?" And he kind of looked at his wife and kind of chuckled a little bit, and he said, "Do I have pain, honey?" And they both kind of chuckled and said that he had been having pain for approximately 20 years. He was in his lower 50 age range, and I just knew that there was something more to that story. And so I just said, "Well, what happened to you when you were a child? What kind of trauma happened to you when you were a child?" And he told me this horrific story of something that happened when he was only 18 months old, and then the subsequent events that happened because of that particular event. And it's pretty clear to me that this person's chronic pain syndrome was most likely tied to that particular incident that happened when he was 18 months, and then the subsequent incidents that happened after that, and never getting the healing that he needed with that limbic system. So when you ask me, why is it important to retrain the limbic system, that's a real life example of somebody that I saw recently who would have probably lived a completely different life had they retrained their limbic system and retrained their brain 25 years ago. And he may not have even ended up with some of the severe pathologies that he was in the emergency department for that day. I can't say that he wouldn't have, but that's definitely a possibility. So that's why we talk about retraining the brain. That's why we talk about the limbic system and the emotions and the other things that go along with that. Yeah,
which is why I feel like it's so important to have the holistic approach that we have, is because we oftentimes people think about changing their physical health, maybe their diet or their movement or different things like that they tend to focus on. But as we can see, like, sometimes there's more to it than that. A lot of times there's more to it than that. And so addressing the mental and the mind, body, and spirit is just really the best overall approach to get to the root or roots of what's really going on. And so often those things can affect each other. And so for me personally, our long journey with infertility has caused just a lot of stress over the years, and then even trying to get healthy can sometimes be really stressful, because there can be certain things you're trying to avoid, certain things you're trying to add, supplements you're trying to take, things you're trying to do, and it can feel like a lot. And so I just really, this excites me, learning more about this, because I feel like as a health coach too, and in my own life and my loved ones, if we can really start with rewiring our brains and kind of getting our limbic system into like a healthier pattern, then I feel like kind of the other changes after that, like you said, are probably going to be more successful. And so I'm really excited about this, and just want to talk a little bit about kind of the different ways that you can do this. Thankfully, there are a lot of different resources. There's a lot of different things you can do. So Dr. Holland, if you want to just share kind of some things that you would recommend.
Yeah, so some things that you can do on your own. The only part of the, I didn't mention this, but the limbic system is part of it's tied to the autonomic nervous system. So when you get that amygdala gets kind of induced with fear and those type of things, that immediately sends a signal to the adrenal glands to pump out adrenaline, which increases heart rate, increases your breathing rate, decreases salivation. Lots of different things that happen to increase that fight, flight, freeze, or fawn. They added an F to make it more of a tongue twister, but fawning, I guess, fainting, kind of thing. Like the fainting goats,
yeah.
They get stressed. It's just funny. So with things that you can do, the only thing that we can do with our autonomic nervous system, outside of those people who are extremely good about doing other things and have trained their autonomic nervous system in other ways, but the people who are just kind of normal people who haven't gotten to that point, the thing that we do have control over is our breath. And it's interesting because with the breath, we have a lot of control over how much oxygen, how much CO2, and some of the physiologic responses that we have. So if you start to hyperventilate with that sympathetic nervous system, it can actually make you faint. It can cause you to get numbness and tingling in your hands and feet and around your lips. And the only thing you have to do to fix that is to breathe. And so there's a type of breath that I teach people. I call it the sniff breath. I don't know really what it's actually called, but it's where you take a deep breath in, and when you nearly get to the top of that breath, and then you do a sniff at the very end of it, and you repeat that 2 or 3 times, then you can actually control your autonomic nervous system, settle yourself down. And some studies are being done on that particular type of breath, as well as other types of breath, where it actually does show that there is a huge impact on that sympathetic nervous system to bring it down and to bring you back into more of a parasympathetic nervous system state. We probably spend more than 90% of our day in a sympathetic drive. We're tense, we're always on, we never take the time to relax. So even just those 3 breaths that can take less than a minute and a half can bring that parasympathetic nervous system back up, allow you to rest, allow you to digest, allow your gut to kind of calm down and heal a little bit. And then there are other things like box breathing. I use an app for breathing because I think that it's so important that I spend a little bit of money on an app called Othership. There's one called Breathwork that I don't endorse any of these particular apps, but I do use them and I think they're important. There's another one called Pause that I use, and it's not a breathing work app, but it's kind of a calming app. It's a meditation type of app, and it's fantastic, and it's just a few minutes, very repetitive. But that breath, I'm going to demonstrate that. Is that okay? So
yeah,
I'll demonstrate it. So this is what that breath looks like. So you shut your eyes, kind of calm yourself a little bit, and then your breath is in. Always breathe in your nose, in through your nose. Okay, so that kind of gives you the picture of it. I want to do like 3 of those just because I already feel so much better just doing the 1.5 that I just did. But that really slows that breath down, helps to calm down that parasympathetic or that sympathetic nervous system drive. So that is one that you can do on your own. There's also one that's a tapping that you can do. So there are different repetitive phrases that you can do and tap in different places. So tapping on your hand, tapping on your face, on your forehead. And there's also an app for that, obviously. And
what is there not an app for
I know,
these
right?
days, right? There's an app for everything.
Exactly. And it's called a Tapping Solution, I believe, is
Okay.
the name of the app. And I use that as well.
Cool.
Do you want to talk about the other ones that we know about?
Yeah. Well, I was just going to say one thing real quick. I feel like it's just been over the last year that I have really embraced the breathing practices and exercises. And in my health coaching training, that was a really big piece of it. And so I got to experience for myself how much it really helped. I honestly think I just thought that's too easy. That's not going to do anything. And it's funny because in my coaching sessions, that's something I try to incorporate a lot because I really do believe in it. And you can tell a lot of times the patient's like, okay, I guess I'll do this, this is weird or whatever. But then afterwards, they're like, oh, wow, I actually do feel a lot better.
Yeah.
And literally most of the time it's like you said, a minute, sometimes 30 seconds of breathing in different ways. I do the box breathing a lot, like you mentioned. And it is just, it's huge. It's so huge for calming down that stress response. So definitely still trying to, make that a part of my routine. It's always a struggle to slow down and to really take the time to breathe. But when I do, it's just so helpful.
It's very helpful,
yeah. So Dr. Holland has recommended for a lot of our patients and, for anyone really, the app called Neurocycle app. And it's by Dr. Carolyn Leaf, I believe. And she is a psychologist.
She's actually has a PhD in communication disorders, I believe. So I don't know if that's like a speech therapy degree or what, but her PhD and graduate work is in some sort of communication disorders. I don't know what that means, but
yeah. But she has an app that's the whole basically the whole thing is meant to help rewire the brain, correct?
Yeah.
And so I have downloaded the app. I'm going to start using it. I'm really excited to use it. There is a cost to it. I think there's a couple different options based on if you want to do like a 3-month program or a year program. But if you like the app idea, that could be a really good thing to look into. And then there's also EMDR is something that licensed counselors can do. Some licensed counselors, I'm not sure if they all can or if you have to have special training for that, but that is something you could also look into, or if you currently see a counselor, you could ask if that's something they do. I know my counselor does that. We've done a little bit of that together over the years, and it's really, really a neat thing as well. So there's also a website and Facebook group that I've come across that's a Christian-based limbic system retraining program. It's called limbicsystemrewire.com. And so I've gotten a lot of great information from them as well. There's a free Facebook group you can be a part of, but they also have different programs that they offer with coaching. And then another popular program is the DNRS, which stands for Dynamic Neural Retraining System. And that is a website online, and they have a program that also walks you through the limbic system retraining.
And that's retrainingthebrain.com is the website for that. And Annie Hopper is one who put that together. And it's a really excellent program. It's a little bit more expensive and a little more time intensive, but because of that, it is an excellent program. And so these other two are also excellent and probably a bit more cost effective. I do know that there's some significant validation through for the Neurocycle app. It's definitely been shown and proven to work, and I'm not as familiar with the limbic system Rewire.com group, but I'm assuming that they're probably also very validated, so have some validated studies behind what they do, as does retrainingthebrain.com or DNRS. So.
Yeah, cool. And then another thing we talked about briefly is the other day was neurofeedback.
Yeah.
If you want to share a little bit about what that looks like.
Yeah, so neurofeedback basically uses the brain waves in the brain to map different things that are going on in your brain. So we all have, like an EKG tracing of the heart, where you get those little lines. We all have these squiggly lines that happen in our brain at different frequencies throughout our brain, and there are different alpha, theta, delta, beta waves that kind of go on, and based on that mapping, we can determine the health of the brain and how things are working within the brain. And through a program called neurofeedback, then you can do things even just as simple as watching a movie while you have the wiring on to determine or to detect what's happening with your brain waves. So you can watch a movie, you can talk about things, you can there are different programs of different sounds and things, and so you try to learn how to utilize those brain waves in a more productive manner, or better manner, I guess. I don't know how to say that, but through different sessions, and it usually takes anywhere from 21 to 35 sessions to help rewire that part of your brain. But it does help with rewiring the brain. It helps with the limbic system as well as other parts of the brain. So even people who've had things like concussions or brain trauma or other things can sometimes improve some of those brain activity places in the brain that have been damaged. So that's what neurofeedback does. And
that's fascinating.
And the tapping does some of that too. So so EMDR, neurofeedback, tapping, those things, those are some of the things that really help with the PTSD and those type of things. So
yeah, that's awesome. That's great. So those are some different things that y'all can look into for seeing if any of those might be a good fit for you or a family member, friends. But there's also some ways that at Holland Health that we can assist you in these things. So I just want to let everyone know that Dr. Holland does offer free 15-minute consults on telemed. So that could be a really cool thing to look into, and you can call, or I believe we can schedule those online as well. So
yeah, so if you go to our website, holland-health.com, and click on Get Started Here, or I think that's what it is. It's been a while since I looked, and if you push the Get Started, then it allows you to make that 20-minute consultation, 15 to 20-minute consultation with me. And we can talk about the things that are going on with your health. You can ask more questions about what we do here, and some of those things that are for the limbic system is, Chelsea here, she does this thing called coaching. We think that coaching is so important that all of our memberships involve coaching, because I don't think that people can get really well without doing coaching. And it's not, some people have a misconception about coaching, and coaching is not to be somebody that just holds your hand and keeps you accountable. They add value to your health journey, and they really help to identify your goals and help move you towards those goals. It's not that they're just going to call you a few times and say, hey, are you doing this, and this? You don't need a mother, you need a coach, right? So so that's one of the things that we offer here. And then we also have red light therapy, which is well, I'll let you talk about it a little bit more, because you've been doing it more and you love it. And
I do love red light therapy. So I started doing red light therapy in January once I started working here, and I was pretty much doing it every time I was here, because the more often you can do it at the beginning, the better. And it was funny because for the first couple of weeks, I was like, oh yeah, I think this is, helping my skin a little bit, or I'm feeling good. But I didn't notice any drastic changes, just kind of some little things here and there. And then I went on vacation for a week, and I didn't do red light therapy for like probably a week and a half to 2 weeks. And I'm telling you, I got home and I was like, I am so achy, my neck hurts, like I was just achy. And so anyway, I was like, I think it is the red light therapy. Because
she also didn't eat as well.
Probably. Well, that might be true, but I'm, even before I left though, I mean, it was just, I could really tell that it had kind of helped bring down the inflammation in my brain, or I mean in my body, probably my brain too. And just those daily aches and pains and kind of stiffness and stuff just really, really improved. So I really do like red light therapy. It's also very calming.
Yes.
It's warm.
Yeah.
It's just very calming. When I get done, I'm just like, oh, I could go take a nap now.
Yeah.
It's nice.
And the lights that we have, don't just hit your skin. It penetrates to the subcutaneous fat. It penetrates into the muscle and actually goes into the bone. It does go through the eyes into the brain, but also it actually has the power to penetrate through the skull into the brain as well, to help regenerate and to liven. Kind of helps with waking up some of those mitochondria and the cells and helping those communicate a little bit better. So red light's fantastic. We do some IV therapies here that can sometimes help with nutritional things that will help with the brain and the limbic system. And then we also, we can talk about a lot of other things when you're here for visits. If you come in as a patient of Holland Health, then there are a lot of other things that we add.
Yeah, because it's always an individualized approach. So, after we can kind of an assessment with you and maybe some labs and different things, we can really individualize the approach. So, well, I really hope that this has been helpful for you guys. I've learned a lot. I'm excited about this. And again, thank you so much for sharing all of your knowledge and your passion with us.
And we also wanted just to say, because we kind of did this because it's emotional, it's a stress awareness month, is if you're suffering, if you are really under a lot of stress, or you're severely depressed, if you're suicidal, definitely reach out and get help. Call somebody. There are some hotlines that you can call. Go to the emergency department, seek some type of help, or if you know somebody that's really been struggling with some of those things, reach out to them and love on them a little bit, because that's a big part of what we need to do for others. Absolutely. Take care of one another, look out for one another, pray for one another, and please share this video with anyone that you think it might help benefit. So all right, well, thank you so much. Thank you. This has been great. You guys have a good rest of your day, and we'll see you next time.